Thank you for that kind introduction. So welcome everybody to this presentation, and I'm going to be talking about why some people may have difficulty sleeping, and especially in the context of COVID, which we have been all dealing with in the last couple of years. All right, so first, I don't have any disclosures to reveal, where I'm going to start off is talking about sleep in general. So sleep is definitely important for health. This list right here is actually not an exhaustive list, just a couple of things that why sleep is important. So sleep is important for things like healing and repairing your body. It's definitely important for preventing chronic disease. So chronic disease meaning things like heart disease, heart failure, things like diabetes even. And even things like dementia. So all important. Sleep is very important for maintaining a healthy weight. Sleep is also very important for your immune system, and definitely, I think everybody kind of knows if you don't sleep well, you tend to get more sick, which is very relevant if we're talking about COVID. Learning and memory. It's very important for your brain health, essentially, for sleep. And this is also kind of where, if you think about long term and why sleep can be related to dementia. Sleep is also very important for improving mood. And definitely when people have better sleep, they are less irritable. But even for like depression and anxiety, definitely when people have better sleep, they'll have less of that. And sleep definitely will enhance daytime physical and mental performance. So it is like a natural performance enhancer when people have better sleep. So for all these reasons and more, which I have not even mentioned, sleep is very important. And when we're talking about healthy sleep in general, for a sleep expert like me, that means somebody gets both quantity and quality of sleep. And quantity, I'll talk a little bit more, but for an adult, in general, that would mean more than 7 hours. And by quality, what I mean by that is not waking up frequently after you're falling asleep, and then going to bed and waking up at about the same time every day. I'll definitely be talking more about daily rhythms and definitely a routine sleep pattern. And then also waking up feeling refreshed. So all of these things would, if somebody had enough sleep and these three things, I would definitely qualify them as having a healthy sleep. And so, just a little bit more about how much sleep does somebody need? I just mentioned that an adult is 7+ hours, but what this slide is showing is actually the amount of sleep you need depends on your age. I think some people can be surprised by that. But if you notice on this slide, essentially, if you're a newborn, the recommended amount of sleep is 14 to 17, the navy blue color. And then the older you get, the less and less sleep you'll wind up needing. So, if we're talking about adult, it's actually the second to last column here. And that's 7 to 9 hours. So, average 8 hours. So that's why people say, oh, an adult needs 8 hours. So it's just the average, 7 to 9 for most adults. And depending on how young or old somebody is, that might change over time. So insomnia. So insomnia is one of those things that can ruin healthy sleep, and cause people to have sleep problems. It's very common. A lot of people have insomnia. I think, depending on what resource you're looking at, you might even get something like 1 out of 3 people will have difficulty sleeping. So very common problem. And what is insomnia? So, insomnia means if you're giving yourself the appropriate amount of hours to sleep. So if you're an adult, you're giving yourself the opportunity to sleep 8 hours. Insomnia would mean having trouble falling asleep, having trouble maintaining sleep, or even, waking up way too early than you then you'd prefer to wake up. So for example, your wake up time would ideally be 8 a.m., but you're constantly waking up 6 a.m., 5 a.m., and you just can't go back to sleep. And then, this is not just like a one-time problem. Everybody will have one bad night here or there. That wouldn't be considered abnormal. But if somebody has really persistent difficulty with their sleep, that would definitely be concerning. And definitely, we're also looking at how does this affect your daytime function? And this could be different things for different people. So if somebody has trouble sleeping, but they can function perfectly well, technically, you don't really have a problem if if you're not really affected by this during your waking hours. But daytime dysfunction could mean anything like really trouble, like concentrating, like having trouble with your memory, like you feel like you're in a brain fog. That's good enough to say your sleep issues is causing a problem. And sometimes people, it could be even worse, like it's causing anxiety, or other things too. And so the COVID-19 pandemic, that's kind of been what everybody's been dealing with the last couple of years. We all know it's a global health and economic crisis from this pandemic. And, it's I don't think there's one person that has escaped being affected by COVID, and definitely has caused like widespread disruption of almost every aspect of our lives at this point. And what we've noticed is that during the pandemic, insomnia has definitely gotten a whole lot worse. And because it's a worsening of insomnia during the pandemic, we've called this Coronosomnia. It's not, the only thing that's gotten worse during the pandemic. So people also have noticed, really there's been a mental health crisis as well during COVID. And, even I've heard some doctors call this like almost a tandemic, because these different issues of the pandemic, of worsening mental health crisis and worsening insomnia, they're all occurring kind of in tandem. So tandemic is also a word I've seen used by experts as well. So how bad is this problem of coronosomnia? It's quite widespread. So there's been, a couple of studies out there, so in one international study, looking at different countries, there was like this, they had this average of like 39% of individuals having poor sleep even before any lockdown started. But then after lockdown, this trouble sleeping really skyrocketed to 52%. So it went from 39% up to 52%. And then even, there are other hints, like in the first 5 months of 2020, right at the start of the pandemic, the Google Internet searches for insomnia increased by 58% compared to the same time period in the previous 3 years. And then also like business data from Nielsen showed that melatonin sales went beyond $820 million in 2020, which is a humongous increase, like 41% compared to the year before in 2019. So, these are only just some hints of like how widespread this problem of coronosomnia is. So what are the symptoms of coronosomnia? So not only does somebody have insomnia, but there's also other symptoms like anxiety, stress, depression, impaired concentration, focus. And people with insomnia can have these symptoms already. But the main key here is that these things worsened or started during the pandemic. So that's the key. And if you think about the pandemic, why would this, have made insomnia worse? And so there was this mnemonic some doctors have used to kind of explain why insomnia got worse during the pandemic. And this is the mnemonic called fed up. People were fed up during the pandemic. So what does that mean? So, financial stresses during the pandemic, emotional upheaval during the pandemic, definitely during, lockdown, there was distancing and isolation, which increased all of this stress, unpredictability. the whole COVID situation, if you remember back in 2020, nobody knew what was going to happen. All of these things were changing. Your whole life was kind of topsy-turvy. And so it was quite unpredictable. And then for sure, people's personal and professional relationships suffered as well. So definitely a very stressful situation all the way around. And you can definitely imagine this is why people had a tough time sleeping. And not only were people getting fed up, essentially, but furthermore, broken routines fueled Coronosomnia. So what does that mean? So broken routines, if you think of the loss of a daily routine, definitely some people started working from home. Some people started changing their work hours to all odd hours of the day that they weren't previously working. There was increased indoor time because of lockdown. People were not going outside anymore, or things were closed, so there was nowhere to go. And then people were staying home, and they increased their electronic screen use and media use. And then also there was overall kind of like decreased exercise and activity that people could do. So kind of these broken routines made insomnia worse. But if you really think about it, why would that also cause a problem? And this is where I think explaining a little bit about what circadian rhythm is, and also why circadian rhythm is important. So your circadian rhythm is your body's natural clock that usually runs on 24 hours, usually. And this body clock that you have dictates essentially all your body's functions. And it's present in every single cell in your body, every single organ system, and if you look at this chart, when your body releases certain hormones, kind of depend on your circadian rhythm, your metabolism, how well you're metabolizing, for example, glucose, sugar, your last meal, kind of depends on what time your body's circadian rhythm is. And even things like your body temperature kind of ebbs and flows according to your circadian rhythm. And definitely for sure, when we're talking about sleep, your circadian rhythm is very important, because if your body's in the night phase of your circadian rhythm, it is a lot easier to fall asleep and stay asleep during that time. And then if your body's circadian rhythm is kind of in your day phase, then it's much more easier to feel alert, and it'll be a lot harder to fall asleep. So this cycle is like very important and dictates so much of our body's functioning. And so, your circadian rhythm, I was saying, it's your body's natural clock. And I said it usually runs on a 24-hour cycle because the day is 24 hours. But it's not in a bubble. Your body's circadian rhythm gets aligned to the daily, 24-hour Earth cycle by something called Zeitgebers. And Zeitgebers is a German word. It almost means like time giver in German. I'm not German, but I think that's what it means. And essentially, these are clues from the outside world that your body uses to help align your circadian rhythm correctly. And what are the most common Zeitgebers and the most powerful ones are these? So, for example, sunlight. And if you think about it, if the sun is out, your body will definitely interpret that it's daytime. You should be in your day phase of your circadian rhythm if the sun is out, for sure. But things like exercise, activity, your food intake patterns, even your social interactions. If you think of humans in general, if it's nighttime, you should be asleep. And so you're not really interacting with a whole lot of people. People really interact during the day. So this really helps your body know there's a lot of social interaction. You should be in your day phase. And then even the natural daily temperature fluctuations, definitely for sure in the afternoon, it's much more warmer than at nighttime. So even your body uses these temperature clues from the environment to know what phase you should be in. And so if you think back again on the my last slide here, broken routines, all these broken routines during the pandemic has really kind of decreased our exposure to Zeitgebers. And so that's why, if we do not have very good Zeitgebers, your circadian rhythm can really be thrown off. And if your circadian rhythm is off, then that's definitely contributing to why some people are having poor sleep. And if that wasn't enough, there's vicious cycles that happen during the pandemic. Once somebody, with all the stress, with insomnia, worrying about it actually begets more insomnia, so it's like an onward cycle. The worse you sleep, the more stress you get out, the harder it is to deal with all the stress, the worse sleep you get, and on and on. And then common coping mechanisms people were using during the pandemic actually worsened their insomnia as well. So sometimes people started taking naps during the day. We're really tired, but if you think about taking naps during the day, it really lowers somebody's sleep drive at night. And also, if you're taking a nap during the day, now your circadian rhythm is off too, because during daytime, you should be awake. Drinking alcohol, very popular during the pandemic. Another possible pandemic here, alcohol consumption going up. And drinking alcohol, yes, it does sometimes helps people feel tired and sleepy, and maybe for some people a little bit easier to fall asleep, but the rest you get is not very good rest. And this is why when people drink too much alcohol and they have a hangover and they wake up in the morning, you don't feel well because that wasn't actually very good rest. So alcohol is not very good for your sleep. On top of that, exhaustion, fatigue during the pandemic made people vulnerable to feeling even more like frustrated, and that definitely led to stress, leading to more insomnia, again, like another cycle. And with the poor sleep, it definitely can worsen your health consequences. Before I said your immune system definitely can suffer if you're not having good sleep. And so if you have poor sleep and then your health is worse and you're more likely to get sick, and then, you get sick and then it's harder to sleep. So it's like another cycle here. So who's at risk for this to happen, for coronosomnia? So first, it could be anyone. Anyone could have fell into any of these cycles, and definitely for sure, there is not one person that managed to escape without their life changing during the pandemic. So almost anyone would be at risk, but definitely for sure patients with COVID-19, because they were actively sick. And so if you were actively sick, your sleep was affected by it. Healthcare and frontline workers also had, extra stress, extra, risk factors for even getting sick from the pandemic. They were definitely at risk. Essential workers also. Other people at risk, unpaid caregivers. This goes back to the kind of like the financial stresses, and especially if you have sick family members, also very stressful. And students and younger adults were at risk as well because, a lot of schools shut down during the pandemic. People had to isolate, and younger adults kind of lost, they were kind of like isolated. And even, not talking about just insomnia, but, I think we've been hearing a lot about younger people having having a mental health crisis, and that was part of it during pandemic. So another pandemic. And then people of color also were at a little bit increased risk for coronosomnia as well. I think, if you think of why, people of color also had a little bit more risk of COVID. And, one more set of people, which I didn't list here, were people that are at a lower socioeconomic status. Just because people with lower socioeconomic status, they have actually more risk of insomnia at baseline. So with things getting worse, they would also be at risk for getting worse insomnia. So what are we going to do? So if you feel like you have, some of the things I mentioned sound so familiar, and you're like, okay, yeah, this sounds like me. I may have had some Coronosomnia, or you may know people who have that. So what can you do to restore your circadian rhythm and also reduce the signs of Coronosomnia? So definitely routine, restoring that routine, that daily circadian rhythm, that should be somebody's focus, will be very important. So things like getting up at the same time every day. Very, easier said than done sometimes, especially if you're tired and your alarm rings, but do it. This will definitely help if you can get up every day to kind of reset your circadian rhythm. Working the same hours, try your best. Pick the hours of work and kind of stick to them. You don't want to work in the morning some days, then nighttime some other times. And, if you're working different hours every day, you're not going to have a good routine. Eating meals around the same time. So, pick your meal time, breakfast, lunch, dinner, or if you're a person that skips one of the meals, fine, but try to eat like roughly around the same time. Remember I said that food is definitely a Zeitgeber. So if you're eating food always around the same time, it's going to be much easier for somebody to restore their circadian rhythm. Definitely getting sunlight. I said that was one of the most powerful Zeitgebers, and so, we're going into spring at this point. So take advantage of the increased sunlight and getting some fresh air out there. And then getting back to your exercise routine, or if you didn't have one before, maybe it's a good time to think of how you want to start exercising and getting into a routine. That activity definitely helps sleep. What else can you do? So things to kind of watch out for and reduce. So definitely reducing alcohol and caffeine. Just be very careful. Again, the alcohol does not help with sleep quality. And caffeine, I think for some people, it's everybody will be a little bit different. Some people are more sensitive to caffeine, some people a little bit less. And also that depends on your sensitivity to caffeine can change with age as well. So just be careful with that. Caffeine can last actually a long time in somebody's body. So people kind of get surprised that, caffeine can last up to 10 hours. So, if you're drinking some coffee or some caffeinated beverage, after lunch, and lunch is, let's say, like 1 o'clock, 10 hours later, that is like about like 11 p.m. at night. So, at that point, it might still be harder to sleep up until then. If you're drinking, a cup of coffee at dinner time, that caffeine can kind of last in your system almost like all night. So that definitely could be contributing to poor sleep and insomnia. Reducing stress. That is definitely going to be key. All the things I was talking about before in that fed up mnemonic, especially those vicious cycles, there's so much high stress, so definitely for sure you want to find ways to reduce that stress to help you wind down at night, especially. And, some specific things you can do is turn off the news in the evening. The news has been kind of sensational, in the past couple of years, especially during the pandemic. If you're looking at the news and you're getting kind of concerned about what you're seeing, especially in the evening, it's going to be very difficult for you to kind of relax at night and drift off to sleep. So definitely you can watch the news another time, but when it's getting late, maybe it's time to just turn it off. Trying a stress reduction technique, and this could be different for, every person, but something like making sure that if you feel like you can't shut off your mind, and that's very valid. There's so many things to be thinking about, so many things to be worried about. Go ahead and actually schedule a worry time. Say every morning at 11, that's my worry time. Give myself 15 minutes. Go ahead, stress out, get it out of there, get it out of your system, and then just say, all right, time to save it for another day. At nighttime, if you're really having trouble, say, all right, this is not the time for me to worry about this. I have worry time tomorrow. If it's really that important, I can worry about it during my worry time. That works. Try it out. What else can you reduce? So reducing napping during the daytime. This definitely, like I was saying, it can kind of get your circadian rhythm a little bit out of whack. It can decrease your sleep drive if there's a lot of napping during the daytime. So you want to save your sleepiness. If you're really tired, you feel like you need to nap, save that sleepiness for the night. Don't sleep during the day. And on top of that, if that isn't enough advice, we can build good bedtime habits. So what do I mean by that? What are good bedtime habits? So making sure you wind down. We're not light switches. You can't just turn yourself on and off at will. The day is busy. The day is stressful. You're going during the day. Give yourself a chance to kind of wind down. Take the day off. Brush your shoulders off. Do something relaxing. Ideally, without electronics, but give yourself a chance to kind of breathe, take that breath, slow down a little bit, and then you'll be ready to fall asleep. Avoiding electronics and screen time. Very important, not just the news I was talking about, turning that off, but, a lot of, if you think of, what are people doing with their electronics nowadays? A lot of it is actually watching videos. You're watching things like TikTok on your phone, YouTube, whatever it is, it's usually videos. And what happens when you watch videos? You go into rabbit hole. It's one video after one video, next video, next video. There's no stop. And if you're watching video after video, you're not sleeping. So put your phone away, unplug, take a breather. This will really help. And what else? So separate your bedroom and your office. Again, if you're working from home, you're doing a lot of things at home, you want to give yourself space. There's a place for work and there's a place for sleeping, and save your bedroom for sleeping. And this will kind of help your body know this is where I sleep, and build up that habit. My bed is for sleeping. My bedroom is for sleeping. It's a common relaxing place. You don't want to go into your bedroom and then think about all the work you were doing there the hours earlier. So separating out your bedroom and your workspace is quite important. And what if you did all these things, yet you're still having trouble with insomnia? So actually, this is a good time to potentially think about talking more with your doctor to kind of find out more, because sometimes with insomnia, there are things that are contributing to your insomnia that are not necessarily sleep related and not necessarily something that you're doing wrong or right during the day. There could be some other medical issues that could be affecting your sleep. So definitely you want to, you're doing all the right things, potentially talking more about your doctor to find out what if there is something that could be affecting your sleep. And actually, this is a great place to start, kind of talking a little bit more about something called cognitive behavioral therapy for insomnia, so also known as CBTI. And this is when, you did all the right things and you're still having trouble sleeping. It wasn't, it's not some other medical thing that we're worried about here. CBT is almost like, think of it as like a sleep training program. Ideally, it would be done with a therapist, but there are also electronic like apps out there that can do a little bit of CBT. And it really, the sleep training is essentially a way to kind of identify what are the things or what other thoughts that are contributing to your insomnia. So it's kind of individualized. It's not one size fits all. You want to try to find out what's causing your insomnia and what else can we do about it. So this is really good. CBT has a very good success rate depending on what study you're looking at. The cure for insomnia is upwards between 70 to 90+%. And that is really amazing if you think about it. If you're thinking about, say, medications, for example, a whole lot less successful percentage already gets approved by the FDA. So something that is amazing as like 70, 80, 90% success rate is like really mind-blowing, actually. So, don't underestimate the power of something like CBT for insomnia. And I think also, just in case, it's if you're going to talk to your doctor and you decide you need a little bit more sleep evaluation, it's also important as well, because there are other sleep disorders that could be contributing to somebody's insomnia and poor sleep. So some of the more common things out there are things like obstructive sleep apnea. And obstructive sleep apnea is super common. And especially when people have insomnia, they can't figure out why they have insomnia. And it's a disease when somebody goes to sleep, their muscles relax, and it's the upper airway muscles that relax a little bit too much. So it causes things like snoring and cause somebody's airway to be blocked partially or completely. And that would definitely cause problems. And so, if you're one of the people who are like, my partner does kind of tell me that I snore really loud, they do kind of poke me at night to wake me up from this, it may be a good idea to think about possibly obstructive sleep apnea that we might have to be looking for. Things like restless leg syndrome, also known as Willis-Ekbom disease, also is pretty common as well. And usually people will feel before you fall asleep, you're still awake. In the evening, right when you're trying to wind down, your legs have this maybe like this creepy crawly sensation. People will kind of give it different descriptions, but kind of like something about it's so annoying. It just makes it feel like you just got to move, you got to stretch. If you feel like you're going to go crazy, if you just sit there in one spot. So if this sounds familiar, I think talking more about restless legs, you can imagine somebody's sitting there and their legs are just going crazy. Like, it will be very difficult to fall asleep if that's the case. And there are other sleep disorders as well. There's actually more than 200 different sleep disorders out there. So if somebody has any one of those, definitely for sure, it would be very difficult to fall asleep. So keep all of this in mind. And I think, where else do I want to kind of spend a little bit more time on is actually medications in general for insomnia. I mentioned melatonin a few times. Melatonin sales, I mentioned, went up during the pandemic. And even if when I showed you that slide for the circadian rhythm, actually, you may have seen melatonin was on that slide. Melatonin is, I'm not going to recommend melatonin. It's a hormone. Number one, people don't realize that your body naturally makes melatonin. So it's sold as a supplement in the US, but be very careful, because it's a hormone that your body makes to tell your body that you should be shifting into night mode. And remember, I said your circadian rhythm kind of dictates almost every cell in your body, every organ system in your body. It's not just sleep. So there could be, some side effects that we don't know about yet. So I think be very cautious when taking these melatonin supplements. They're sold over the counter. It's much better to find out why you have tough time sleeping rather than just taking medications or even other sleep aids. There are other prescription medications out there for the right situation, for the right person. Maybe it could be useful, but it's so much better to find out what's driving your insomnia. Why do you have it? You want to fix the root cause and not just covering it up with a pill that'll make you drowsy. So that's some caution definitely to pay attention to there. So a couple of references, but I think this is actually a great time to take some questions.
Thank you so much, Dr. Mok. And we already have a question in the Q&A box, but I just want to mention to all of our attendees that we do have it open for questions now, and you can type them in the Q&A box for Dr. Mok. So Eric has this question: should we try to wake up and be active in the middle of the night? Healthy to practice two segmented biphasic sleep, thought to be normal in the pre-industrial era, when electrical lighting wasn't available and people began a first sleep phase at sundown?
Wow, what a great question. Basic sleep. So Eric is right. So Mr. Bright is right here. Before humans invented electricity, people did have what we call biphasic sleep. So you would go to sleep when the sun went down because there was no electricity, there was no light. So there wasn't much you could do once it was pitch black. And people would sleep. And then in the middle of the night, they would wake up and then they would go and do other stuff, like get your farm tools ready or whatever it is in the middle of the night. And then you go back to sleep until the sun went up. So your sleep was split into two phases. So that's why we call it biphasic. And actually, there are still some societies in the world that still practice biphasic sleep, actually. So it hasn't completely gone away, even in the modern era. Where I caution people with this biphasic sleep is that these people before the industrial era, they had plenty of sleep. So you think about even now, how much sunlight do we have? And then how much dark time do we have? There's 12 hours of dark right now. And we just started spring. So you don't need 12 hours. Before I said as an adult, average 7 to 9 hours of sleep. So 8 hours of sleep. So you would definitely get plenty of sleep. If there are 12 hours of dark, you'd get 8 hours of sleep. And then so you could have 4 hours of doing other stuff in the middle of the night. So you wouldn't necessarily want to do that now, because I think, if you try to biphasic sleep schedule, you may wind up with not enough sleep. And I think that's, for the modern world, that's probably the concern, not getting enough sleep here. And actually where, nighttime awakenings is also a very common concern for a lot of people. I wake up at night, oh my gosh, is this terrible for my sleep? It's not, for this reason. Naturally there are awakenings at night. As long as you get enough sleep, number one, it's okay to have quick awakenings or even longer, but definitely getting enough sleep. And then also remember that daytime is functioning. If you're functioning perfectly during the day, you're not drowsy, you can wake up perfectly cheery, no need for coffee, and do everything to, you're functioning optimally. Go ahead. It's actually, it's not bad to do that.
Excellent. Thank you. Mary has a question. What do you suggest for restless leg syndrome?
Oh, that's also a very good question too. So for restless leg syndrome, for a lot of people, I think having a non-pharmacologic strategy is very good. So for some people, actually even having a little bit of stretching, don't go too crazy at night, because that's exercise right before bed is kind of stimulating. But a little bit of stretching might be okay. A little bit of massage might be good enough for some people. If not, I would definitely, avoiding things that can make restless legs worse. So common things, caffeine definitely is a huge culprit here. Smoking, so nicotine or nicotine products can make restless legs worse. Alcohol making restless legs worse. So I would try to avoid these three things first, and then making sure that during the day, you're not sitting around all day. Get a little bit of, stretch out your legs a little bit also during the day too. And that might be good enough. If that's not enough, there are medications out there. And then this is when you definitely want to talk more with your doctor.
Very good. Thank you. Yvonne has a question. What about people who regularly wake up after several hours and then read for a while and then try to go back to sleep? How can they sleep through the night?
Yeah, also a great question. So I think that, I mentioned a little bit earlier, waking up actually is not necessarily abnormal at night. Every person actually has natural awakenings at night. I think it's more of a problem when people wake up at night and you're really struggling to fall back asleep. So that would definitely be insomnia at that point if you're not satisfied with that. So I think definitely go through my list of tips of what to do. I think where I will tell people is if you are waking up at night and you are definitely not falling asleep and you're getting frustrated and you're feeling like you're struggling to fall back asleep, get out of bed. So it sounds really, really counterintuitive almost, but sometimes when people try a little bit too hard, you're not sleeping. So, if reading a book helps calm you down, go ahead. But if you're really struggling, you're not falling asleep, go ahead, leave the bed for a couple of minutes, read your book, do something relaxing. Then when you're sleepy, go back to bed and try again.
Very good. Thank you. Okay, we have a number more questions. What should you do if you wake in the middle of the night and can't fall back to sleep? Which I think you probably just covered there. The next question, which do you benefit more, exercise in the morning or evening?
That's also, very great, very good questions, I think, from the audience. So I think whenever you can get exercise, that's going to be, a good time, because people have busy schedules. So whenever you can fit the exercise in, that'll be great to have that routine. But whether or not exercise is let's say time crunch is not a problem, and you can choose whether or not to have exercise in the morning or the evening. Actually, you might want to do a little bit of research on this one. Depending on when you exercise, you might be burning more calories or building more muscle. So that's how your circadian rhythm is actually very important. You'll be doing the exact same exercise, but depending on the time of the day, it could help you reach a different goal. So, I think in general, if you're having trouble sleeping though, and you want to strengthen your circadian rhythm, and you're going to exercise and you want the sunlight, then morning is probably a good combination there. And in the evening, you probably want to avoid having too much vigorous exercise right before falling asleep, because exercise gets your heart rate up. It gets you breathing harder, and that is definitely not calming. So you're not going to be able to wind down easily if you just ran a mile and then you're going to jump into bed. So give yourself time after your last exercise before going to bed.
Excellent. Thank you. Next question. Do you have an opinion on CBD or TCH? Maybe they mean THC? Tinctures, liquids for sleep.
Yeah. So, at this point, I think the research is still out there. I don't know if there's like a definite answer on that. I promise people are definitely looking at, whether or not these things can help sleep. They may not. There's also not just CBD and THC, but also different combinations of them. So I think at this point, we don't know what, if it helps and whether or not what ratio of CBD to THC helps the best.
Very good. Thank you. Let's see. This question, a statement. I need to get up to urinate a few times a night and sometimes cannot fall back asleep.
Oh, yeah. So this is definitely something you want to talk to your doctor about, because urinating at night, and, I think once is reasonable for a lot of people, but if you feel like you're waking up 2, 3, 4, 5 times or more to go to the bathroom, there could be multiple reasons for this. And so you definitely want to tell your doctor, this is a concern for me because, my sleep is really disrupted. I will say this. Sometimes when I hear people say they urinate 2 or 3 times or more at night, sleep apnea, surprise, is actually one of the reasons. So if any of those sleep apnea symptoms sound familiar and you're urinating multiple times a night, it's definitely time to potentially think about getting a test for your sleep apnea to see if you have sleep apnea.
Excellent. Thank you. Do you have, Diane would like to know, do you have suggestions of what we should do when we wake up a few hours too early at the fourth or fifth hour?
Yeah, also a great question. Early morning awakenings sometimes can get a little bit more tough for people to go back to sleep. Once they got a good chunk of sleep in, and the reason is because I mentioned earlier there's something called the sleep drive, and the sleep drive is almost like hunger. The longer you go without sleep, the higher and higher your sleep drive will be. So if you take a nap, you lower your sleep drive. If you went to bed at night and you slept for a good 4 or 5 hours, now your sleep drive is going to be a lot lower compared to the beginning of the night before you went to sleep. But things that will help increase your sleep drive. That's what we really want. If we want to power you the whole night to stay asleep, is definitely avoiding those napping during the middle of the day, because again, that will decrease your sleep drive. And then also, if you're feeling like you're frustrated, don't stay frustrated in bed. Definitely, you do not want that. The more frustrated you are staying in the bed, the less sleep will come. So it's okay, I think, to once again leave the bed, take a break from trying so hard, doing something really relaxing, keeping the lights really dim, and then try again. And then if you're really having trouble, you might want to find out, is there something waking you up during that fourth or fifth hour? If you're having back pain and you've been laying one position all that time, and then all of a sudden 4 hours later you're having back pain, definitely want to get that addressed. So if you can identify what is waking you up at that point, definitely want to have that taken care of.
Yeah, good tips. Thank you. Mary would like to know, is it safe to take a small dose of Ativan before bedtime?
I think that, Ativan itself is a medication in the class of benzodiazepine. And Ativan, it's probably for most people meant to decrease your anxiety. So if you feel like anxiety is what's causing you to having trouble falling asleep, very common, especially during these times, with COVID, all the stresses people have, there may be better medication to treat your anxiety. And there may be better things other than relying on Ativan to get your anxiety level down. So, is it safe? I think if you're taking medication as prescribed by a doctor, in general, it should be pretty safe. But if it's really the anxiety causing the Ativan to be effective, there's probably better ways than the Ativan.
Thank you. Amanda would like to know, when is napping a good idea?
Oh, yeah. So, on my presentation, I did say, try to avoid napping during the day a lot to help increase your sleep drive and to help kind of realign your circadian rhythm. But there are situations where napping is a good idea. And that situation is if somebody is driving and they are really struggling to pay attention to the road. For safety reasons, you definitely want to take a break from driving, find a good spot and take a nap. It's okay, because definitely driving while drowsy is, it's surprisingly, for a lot of car accidents, not even car accidents, if you think of things like train accidents, this is why pilots cannot, they're mandated to have like how much hours they can be on a shift, because you definitely need sleep. So, if somebody's driving, they're really drowsy, you're really having a tough time, definitely just stop the car, take a break, take a nap at that point. You want to dissipate your sleepiness.
Thank you. Celeste would like to know, does warm milk help you fall asleep?
Oh, great question. So, I think, if you feel like warm milk helps, I don't think it's something you have to avoid. I would, what I would avoid is drinking, way too much warm milk, though. Just be careful with how much you're drinking, because if you're drinking, quite a bit, it may wake you up because now you have to go to the bathroom in the middle of the night. So just be very careful with that. And definitely for sure, for people who can't withstand dairy, also not a good idea.
Thank you. Next question, Kay Chan would like to know, how much sleep do teens need?
Oh yeah. So teenagers, depending on if they're like a younger teen or an older teen, it would depend. The answer would depend on that. So a younger teenager may need up to 13 hours of sleep, 14 hours of sleep even. And for a teen, let's say in like high school, and even a young adult up until like the early 20s, needs closer to 8 to 10 hours of sleep. So maybe 9 hours on average. So teens definitely, even the younger 20s, 8 hours may not be enough sleep actually for them.
Very good. Let's see. It looks like, this person says they're 69 years old and have never needed much sleep. Lucky them. They do get about 5 to 6 hours a day and feel great when they get up, and they want to make sure this is not unusual, correct?
Oh, yeah. So, most, before I was saying, how much sleep does somebody need? The average adult will need between 7 to 9 hours of sleep. There are people that we consider what we call short sleepers. So short sleepers are people who will not need that 7 to 9 hours of sleep. So maybe 5 or 6 hours, that's shorter than the average. And they will go through life functioning at their peak, just optimally. And those lucky people, or we don't know if they're lucky or not, those are the short sleepers. It's much rarer than people think, though. So I think just you might be a short sleeper. And the real test, I think, is if I had you're only getting consistently 5, 6 hours a day, but you can wake up. You don't need caffeine to feel awake in the morning. You're doing everything great. You're not falling asleep or like in a boring meeting. You can watch a very long, boring movie without feeling tired at all. Maybe you are one of those short sleepers.
Oh, wonderful for them. It looks like we've come to the end of our questions. I just want to there was a question kind of like this. I just want to let everyone know that the presentation has been recorded with Dr. Mok, and that will be available in a few days after this event on our website. I want to thank Dr. Mok for this great presentation and all those great tips. And for the audience, for the excellent questions and for joining us today.
All right. Take care, everybody, and sleep well. Sweet dreams.
Great. Thank you. Have a good day.